We have an amazing team of physician assistants on our program that are smart, and we all get along. And the relationship that we have with them is integral to how this ICU runs. And they really are the glue to our intensive care unit. Without them, we would not be able to run this ICU.
I think we have a great team here. The PAs and the attendings have a great relationship. There's always an attending here that you can count on. You're never alone, you're never by yourself, especially in this type of environment. We have a 24-bed ICU, it's very busy. And you never feel like there's nobody that you can call or you can. I think that's one of the greatest things about this job. I came out of PA school as a new grad and I started working here. I started working here on the step-down floor. So I got a lot of experience working on the floor first, and then I transitioned to the ICU, and it's just, I can't even begin to tell you what I've learned here. It's amazing.
If anybody's interested in higher education, then Mount Sinai would be a wonderful place for anybody to come to, just because there's specialties in so many different disciplines. And there's really no limit on what you can learn while you're here.
We have an extensive training program when our physician assistants begin their job with us, and when they join the team. It's a 12-week program where they follow and shadow one of the more experienced physician assistants, and then they join those lectures that we carry out every day in this cardiothoracic intensive care unit. They'll also have one-on-one sessions with the intensivist. Sometime during the day we may pull them aside and start teaching them about acute kidney failure or cardiogenic shock. And so I think that multi-prong approach allows us to train them broadly and give them a good breadth of training.
Seeing these patients come in and they end up getting a heart transplant, and the next day they're off of a ventilator and they're able to be conversive with you. It's really extraordinary.
One of my most rewarding experiences, we see a lot of sick patients here. It's when you see the patients come back. Some patients that were here for months and they were so ill, and then they come back, and they'll come back months later or even a year later, and they'll walk into the ICU and you'll see them, and it's just amazing. It's amazing.